Good evening to everybody and welcome to today's session. AIIMS 2019 May. Every year when we discuss the AIIMS, NEETPG, PGI, JIPMA of that year's question bank, it gives an opportunity to get an insight into what the examiner wants. Are we preparing in a right direction to match up to the expectations of the examiner with the high yield topics or not? So that is the whole idea. So we finally have precipitated, after doing a review of the last 15 years of nearly 30,000 MCQs from all these major question banks, that there are 953 topics from which 90% of the examiner's question bank basically comes in any entrance exam that you go, whatever be the name. It can be NEXT, it can be DNB, it can be NEET, or it can be FMGE or anything. Ultimately, the bottom line boils down to these 953 topics. Welcome once more, Vivek, Alek, Simi, and Sara Kaderi, many more who are all online. And yesterday night, almost till early morning, 5 o'clock, we had been preparing for this discussion. And a lot of you had been giving company in the WhatsApp group. Really grateful to all of you. So let's make the great beginning. Vidya, Sagar, and many more. Mayank. So let us start with the first quiz. I hope you're all ready, because unless you take the questions extempore like a quiz and face it, the reality, then only you will be able to enjoy. Yes. Let us start with a quick quiz, but I will give a little longer time for you to respond. Let us say 10 seconds is too fast. So let us make it 20 seconds. There are about 70 questions. So you will take the next 20 minutes in order to answer them. So I think we can make it a little less time, around 15 seconds each question, and 4 questions in a minute, in 1 minute. So the next 70 questions means you will take about say 15 minutes in order to answer all that. So please unface your fingers, get ready to thinking mode from listening mode. Listening is boring. Somebody said, I hate to be taught but love to learn, right? So we should be loving to learn but hate to be taught. So exercise whatever that you know, punch your answers, push your answers, see how your classmates are answering, and then I'll be there back with you for the discussion, right? So now let's make the great beginning of the AIIMS May 2019. A patient underwent thyroidectomy for hyperthyroidism, and 2 days later he presented with the features of thyroid storm. What is the most likely cause in this given scenario? It is the inadequate preoperative preparation which typically leads to the development of the thyroid storm. So you should be quite sure, doctor, what are all the predisposing factors for the development of the thyroid storm? Any infection, trauma, diabetic ketoacidosis, myocardial infarction, cerebrovascular accident, pulmonary embolism, surgery, withdrawal of the thyroid medications, iodine administration, and if you excessively palpate the thyroid gland, sometimes it can precipitate the thyroid storm. Ingestion of the thyroid hormone, any of them can be responsible for the development of the thyroid storm is what you need to basically remember. Now, what is the treatment for the staghorn calculus with a mild hydronephrosis is my question to all of you. I'm unable to get the hotkeys, doctor.